Hello, everyone. Thank you for joining us today for the Mass Bio's Makeshift Happen program, where we discuss anything and everything related to equity, diversity, inclusion, and engagement. For the month of September, Makeshift Happen is powered by Foundation Medicine. I can't thank them enough, not just for the support and not just for their commitment for ED&I, but for everything that they do for cancer research. Before we get started, I would like to go over the ground rules with you. For the first 20 minutes or so, it would be a Q&A portion between me and the guests, and that's where we're going to mute everyone's audio and video during this time. But please do not hesitate to raise your hand or to ask questions in the chat section. And after that, the next 20 minutes is going to be opened up fully for audio and video, and we want the program to be interactive and participative, so don't hold back on your questions. Now, let's get started. September is National Awareness Month for prostate, childhood, ovarian, blood, leukemia, lymphoma, and thyroid cancer. Today, we will discuss promoting prevention and screening among racial and ethnic groups, how we need to attack cancer from all angles, and how biopharma can work with civil society to accelerate cures, remove barriers, and to care and achieve health equity. It is almost impossible to keep with the flurry of legislative and regulatory proposals to preserve access to local, affordable cancer care for every American. I would like to introduce you today's guest and a leading voice for the oncology community, Dr. Shalini Vallabhan, Managing Director of Government Relations at American Cancer Society Cancer Action Network. Thank you for being here, Shalini. Would you take a brief moment to tell us about your background and what brings you here today?
Oh, thanks, Edie, and it is a pleasure to be here with everyone. My name is Shalini Vallabhan, and I've been with the American Cancer Society for 15 years, over two tours of duty. And I have to say that I am so blessed to do what I do. I get to marry my passions for politics, public policy, and improving health for communities and states and countries, and even I've had the opportunity and privilege of working overseas in Asia. So it is a pleasure to be here with so many dear friends and partners, and I look forward to the conversation, Edie.
Well, thank you for joining us again. And I would just like to start off with a question. Why is it so important for organizations like ACS to prioritize ED&I initiatives?
Sure. The American Cancer Society is laser focused on strengthening diversity, inclusion, and equity across our organization and work. And the simple reason is cancer affects everyone. 1 in 2 men and 1 in 3 women will hear those words, "you have cancer," in their lifetime. But cancer doesn't affect everyone equally. So I'm now going to have a few statistics, and I apologize in advance, but I think it's important to frame this conversation.
We love the information, so please share.
All right. Despite lower incidence rates, African American women are 40% more likely to die of breast cancer than white women. Asian, Hispanic, and American Indian, Alaska Native populations are least likely to be screened for cancer. The overall cancer death rate is approximately 20% higher among residents of the poorest U.S. communities compared with the most affluent. Research confirms that the LGBTQ community has a disproportionate burden of cancer. And finally, research confirms that individuals without health insurance are more likely to be diagnosed with advanced cancer and therefore have a higher risk of cancer death than those who are insured. And unfortunately, we know that racial and ethnic minorities are more likely to be uninsured and underinsured. I know everyone on this call will agree with me that these statistics are simply unacceptable. And behind these statistics are friends, family members, colleagues, and neighbors. These are just a few reasons why the American Cancer Society and our nonprofit, nonpartisan advocacy affiliate, the American Cancer Society Cancer Action Network, also known as ACS-CAN, has prioritized equity, diversity, and inclusion as core pillars on how we work as well as what we work on. We believe that no one should be disadvantaged in their fight against cancer because of how much money they make, the color of their skin, their sexual orientation, their gender identity, their disability status, or where they live. We have set an ambitious national goal to reduce cancer mortality by 40% by the year 2035. We cannot achieve this goal unless we reach every community to help ensure that everyone who needs it has access to evidence-based cancer prevention, screening, diagnostics, treatment, and care. We must reflect across our staff and volunteers the communities we seek to serve to reduce the disparities that I mentioned earlier. And so quite simply, Edie, in order to achieve our mission, we need to be more diverse, more inclusive, and keep achieving health equity as our North Star.
Well, I'm going to ask you a question later, and that's going to be more involved about how reducing cancer by 40% by 2035 is an aggressive goal. So I am going to ask you, what are some of the mechanisms that's going to be in place, legislative-wise, people-wise, organization-wise, research-wise, to accomplish that goal?
Sure.
But right now, I'd like to ask, how does the ACS mission to save lives, celebrate lives, and lead the fight for cancer, a world without cancer, and what does that saying mean to you?
Well, the American Cancer Society has been in this fight for more than 100 years. And because of that history and experience, we know that we need to attack cancer from all angles. So again, many people on this webinar know that we have played a role in many of the most important cancer research breakthroughs. We support scientists from across the country who are working on cutting-edge research. And in Massachusetts alone, we have 92 grants in effect for a total of $147 million. Through ACS-CAN, and this gets at your question a little bit, Edie, we are advocating for public policies focused on accelerating cures, improving access to care, and preventing cancer. And we are executing each of these priorities through a lens of health equity. We have a live 24-hour, 7 days a week cancer helpline. We provide patient support services such as free rides to treatment and free lodging near hospitals. And we engage and bring communities together in the fight against cancer through events like Relay for Life and Making Strides Against Breast Cancer. These community events help build a nationwide movement in the fight against cancer. And if I may add, and I know Alice and Zach and others are on the line, there is a not so secret ingredient in terms of how we work to achieve our mission, and that is through volunteers. Volunteers, whether they are a researcher's ambassador, and thanks to a few MassBio staffers who've already signed up, or you're an ACS-CAN volunteer, or you're helping to raise funds to power the mission, volunteers are the heart and soul of this organization. And we need more volunteers here in Massachusetts and across the country to join us in this fight. And I would just add, Edie, that of course, the American Cancer Society and ACS-CAN can't do this alone. We need strong partnerships with MassBio, Dana-Farber Cancer Institute, Foundation Medicine, and a whole host of other stakeholders across the life science and healthcare ecosystem. So that's how together we can reduce mortality by 40% by the year 35.
Now, we talked about health equities and disparities, and we saw how COVID-19 exposed a lot of that in some of our communities. How did COVID-19 impact the ACS?
Sure, thanks, Edie. Well, as you said, the COVID pandemic has impacted everyone, everywhere. And among medical experts, people of any age with certain medical conditions, which includes cancer, are at risk for severe illness for COVID-19. So to learn more about how COVID-19 has impacted cancer patients, ACS-CAN surveyed 1,200 patients and survivors to learn more about their experience throughout the pandemic. And what we have found is that the pandemic is affecting cancer patients' ability to get their care. 87% of cancer patients reported some impact to accessing healthcare due to the pandemic, and 27% of patients who are currently in active treatment reported a delay of more than 2 weeks in cancer care. The economic impact of the pandemic is also impacting cancer patients and survivors. 46% of respondents said they experienced a change in their own ability to pay for care. And 23% are worried about losing their health insurance. This is a tough time for cancer patients, and indeed all patients who are struggling with serious illness. In terms of the impact of COVID-19 on our organization, I think it's not an exaggeration that the American Cancer Society is facing a threat to our mission like never before. The pandemic has severely limited our annual fundraising and in-person community gatherings, which has created a significant financial hardship and forced several cost-saving measures. We are expecting a minimum of a $200 million shortfall this year. And as a result, we had to reduce our budget by approximately 30%, which included eliminating 25% of staff positions nationwide. Despite these deep and painful cuts, our programs, including our Hallmark Research Grant Program, are currently in jeopardy. Each year, the American Cancer Society invests about $100 million in new research. Because of this budget shortfall, we are at risk of cutting cancer research funding by 50% this year. I know the mass bio community in particularly understands the impact of delaying medical research and innovation. We must continue to fund scientific discovery and innovation to ensure that, for example, immunotherapy, targeted therapies are available to treat all cancers. We cannot stop this momentum. We need volunteers, donors, and partners to join us now.
How do you see biopharma working with organizations like the American Cancer Society and the Cancer Action Network to accelerate these cures and remove the barriers that you mentioned to care for and achieve health equity in all these communities?
Yeah, that's a great question. And I think, as I mentioned earlier, we can't do it alone. It takes partners with life science companies, healthcare institutions, other businesses, as well as other nonprofit organizations, all working together to keep health equity as a North Star. If there's ever a time in our nation's history, what is happening with the COVID pandemic is shining a spotlight on health disparities. We can partner in terms of advocacy. Certainly, biopharma can help fund and support grant programs and research programs that both address health disparities and accelerate innovation and cures.
Thank you for that. And in a few minutes or so, we're going to open up the audio and video for everyone.
Sure.
And in the interim right now, I would like to just ask you, What is the ACS doing to make sure everyone has better access to screening and prevention information?
Sure. You know, again, through our advocacy work, we are advocating directly for improved access to healthcare and access to cancer screening and prevention, and in particularly for medically underserved communities. Our advocacy at the federal and state level is dedicated and focused on improving and widening access to health insurance, increased funding for community health centers, as well as increased funding for programs at the CDC that particularly are increasing access to breast cancer, cervical, and colorectal screening procedures for medically underserved communities. And from the ACS side of the house, our research program and our website and Cancer Information Center are all providing important information and education to all communities in terms of how we can all ensure that women and men are getting screened for cancer as well as getting the treatment they need.
Where would you say are some of the red zones, some of the ground zero areas where ACS and other organizations like ACS are having trouble reaching certain racial and ethnic groups?
That's a good question. I think as we understand health disparities, the hard work of going underneath those statistics and really delivering the information and the programs so that we are reaching these quote unquote hard to reach populations in ways that we have not done so before, because obviously if the statistics are where they're at, we have much more work to do. Again, so ACS, American Cancer Society, and ACS-CAN is working with a variety of partners to reach these hard to reach communities. And I think working with partners such as Dana-Farber, the Mass General Hospital, as well as other partners, we can together reach these populations. On the advocacy side of the house, there is so much more we can do. Our agenda is very much, as I said earlier, focused on health equity as our North Star. And underneath that are the policies to improve access to care and health insurance, to increase funding for research, and to prevent cancer before it starts. We are excited and ready to partner with both industry and nonprofit organizations to advance these policy issues. Policy making, changing policy happens in windows of opportunity. And when those windows open, all of us together need to be speaking with one voice in terms of what can be done to change policies and really enact the change that we know will result in healthier communities.
Well, we're starting to open up the mics and video, and we have one question for you.
Okay.
You work in government relations. What's on the policy horizon?
Well, Congress is back in session, but unfortunately they have about 10 days to do everything that they said they were going to do in terms of the stimulus package, in terms of all the appropriation bills that are still left to pass Congress and get signed by the president. So the conventional wisdom is that there's not going to be a stimulus package, at least at this time, and that Congress will pass continuing resolutions to keep government funded through the election. So, from that perspective, I think everything will be on the table once we're through the election and Congress is back. If we've learned anything over the past 6 months, we've learned that access to healthcare and insurance is really important in order to survive a pandemic and cancer. The Supreme Court is going to rule on the Affordable Care Act in November.
Okay.
We don't know what the status of the Affordable Care Act will be at that point. Will pre-existing conditions still be covered? I think some other issues that are going to be on the horizon is really zeroing in on the affordability of healthcare for all Americans. There's also been discussions and work on building upon the 21st Century's Cures Act.
Okay.
And given that we're living through the worst public health crisis in more than a century, Cures 2.0 will be a focus for the next Congress, and we'll be at the table with all of our partners with recommendations to increase patient participation and engagement in clinical trials. So those are just a few things, and that's just healthcare.
Oh my gosh, I could not imagine what your day must look like. And we have another question in regards to policy. What should policymakers be focused on to help improve health equity in the long term?
Well, I think first and foremost is to ensure that everyone has access, affordable access to quality health insurance. This is an unacceptable situation in the United States, and we need to address this as quickly as possible. I think other areas in terms of health equity are also going to have to look beyond the healthcare system and beyond medical care to really look at the social determinants of health and to understand how income, housing, access to healthy foods, issues like this are also foundational to helping communities become the best that they can be. And these are all issues that we're going to have to address as a community in order to really achieve health equity in the long term.
How is the insurance companies assisting with the fight to make sure everyone has access to affordable and good care?
Well, I think health insurance companies are partners, just like life sciences and hospitals and other organizations. We need a strong health insurance ecosystem, just like we need a strong life sciences and healthcare delivery system. It's going to be a balance once you have all of the stakeholders in place to negotiate and determine what the next version of healthcare reform will look like. What I can assure you is that ACS-CAN and the American Cancer Society will keep a laser focus on the patient so that we are ensuring that whatever the next iterations of healthcare reform or the next Cures 2.0 look like, that we are improving in a measurable way how patients are able to access high quality cancer care.
We're talking about patients accessing high quality cancer care. As you know, tomorrow starts the National Hispanic Heritage Month that goes from September 15th through October 15th. Can you enlighten us on some of the things that ACS is trying to do to work within some of the Latino communities?
You're asking a question that I actually don't have a lot of information specifically on.
Sure.
But I'm happy to get that information back to you, ED, so that we can certainly share it, because what I will say is that we have programming going on. The beautiful thing about the American Cancer Society is that we're a community-based organization across the country. I can tell you, just in California, as one example, we have launched a program to reach out to Hispanic and Latino populations in Southern California to really educate and become partners with them on how best to reduce tobacco use. That is just one example of programming that's currently underway. I know that we have a lot more happening, and I can get you that information if you'd like.
Oh, I would love to, because I'm just curious to see what different ways are we looking to reach people in different communities? How are we learning to connect with them and communicate with them in different ways for them to have access?
Correct.
And it looks like we have another question for you. You mentioned several of your funding programs being in jeopardy and risk of cutting cancer research by 50%. Does that threaten ongoing research in the future?
Well, I would say that our grants that are already funded and approved are funded. We are able to meet those obligations and commitments. However, I will add that because of the financial situation that we're in right now as a result of the pandemic, we are at risk of not being able to fund 50% of our new grants that are coming in, the new grant applications, because of reduced funds that are coming into the society.
Wow. So with that being said, how are investigators going to continue the work that has already been deemed important enough for funding?
That is a terrific question. We need to figure this out. This is when you look at the research ecosystem and the role the American Cancer Society plays, one of the unique things we do is really fund young investigators. And we're able to support them early in their career so that they get that experience and kind of research, the research, I want to say, oh my gosh, having a senior moment now. But they have
It's Monday, we're all having it, so.
Thank you, Edie, that's very kind of you. They're basically showing the results that they can handle large research grants from the Cancer Society. And it then sets them up for funding from institutions like the National Institutes of Health and the National Cancer Institute. And then that eventually could translate, if it's that type of research, into working with life sciences and going into more translational research. So it is very much an ecosystem and a pipeline. And if you start and squeeze the pipeline at the beginning, we actually are at risk of really creating a ripple effect across the research ecosystem and timeline. And if you think of what's happening now in terms of targeted therapies, many of those innovations now are really birthed 30 years ago when we mapped the human genome. And so research and innovation takes time. It takes decades in many cases. And so we just can't afford for that research pipeline to get strained at the very beginning with early investigators. And that's why we need help. We need partners to join us and help us solve this problem.
By any chance, and this is just Edie asking, I hope it's not hitting a third rail right now. With the climate right now, we have a very divisive administration and power right now. And how do you see that affecting your goals, the ACS goals?
It is a difficult time. It is, it's a moment in our history that, at least in my lifetime, I have never seen the acknowledgement of the racial injustices that have taken place across the country, as well as having a pandemic that is putting strains both in terms of health and economics across the country. And as you said, there's a heightened level of partisanship. And sometimes it's hard to just get out of bed and, you know, you don't even want to look at your phone and see what the news is. But I think that it is an opportunity.
Okay.
I really do think that this is an opportunity for us as individuals, as communities, as organizations and companies to lean in and listen and learn from each other, and also press for the change that needs to happen. As John Lewis said, we need to make some good trouble. Yeah. And I think actually we're at a moment in time in our history where we will be able to make good trouble quite a bit from now through next year.
And we have about 5 minutes left in the program, and Jason would like to know, are cancer patients being disproportionately affected mentally by the COVID-19 pandemic, especially with economics right now, with the economy right now?
Yeah, well, I think what we saw in our survey, and certainly in what we're hearing in terms of the calls that are coming into our call center, is yes. Many of the calls that we're hearing are related to isolation, fear of how COVID-19 could impact them, both as a patient and as well as delivering or accessing their own cancer care. And, you know, again, so it just leads me, and I know that it leads my staff, teammates and volunteers to just do more. We've got to be on the front lines on all our areas of work, whether that's research, information and support, or advocacy, so that we can help during this very difficult time.
Well, while we're coming up on our very last question, Zach, if you can be so kind to share Shalini's contact information with everyone. I'm quite sure that they'd like to follow up with you individually, so I want to make sure that they have that information and before we end the program. And also the last question is, are there any new important reports in regards to mental health within the cancer community?
You know, off the top of my head, I can't think of a specific report. Of course, issues of palliative care, even without a pandemic, are particularly important in terms for cancer patients and survivors. So we always we're always watching and assessing the quality of life that patients and survivors have. But again, that's another great question, and I'm happy to do a little bit of research to see if there are specific articles or studies looking at the impact on cancer patients right now.
Well, that brings us to the close of the program. We're approaching 2:40 p.m. Eastern Standard Time, and there's a tremendous hope in cancer research, and let's make sure that we're doing what we can do. I thank everyone for attending and participating and for being an ally. For those interested in learning more about ACS, and CAN volunteer opportunities and events, please reach out to Shalini. Her contact information is in a chat function right now. I would also like to thank Foundation Medicine for their support. And finally, I'd like to give a shout out to some of MassBio's upcoming programs. Unfortunately, we were unable to host our annual golf tournament that everyone looks so forward to because of COVID-19. So please join us on September 17th for the MassBio Ed Comedy Classic as an opportunity to give back to biotech education community. And this Saturday, I'm participating in the United Negro College Fund Virtual Walk for Education. Let me know if you'd like to join me. And September 22nd, we have the Mass Bio Town Hall with Bob Coughlin and Abby Selniker. September 29th, we have Make Shift Happen celebrating National Hispanic Heritage Month with Dana Farber, who's visiting with us right now. And last but not least, we have September 30th, Mass Bio Digital Health Impact 2020. And please know that you can always go to massbio.org/events for an update on all of our events. Have a great afternoon and look forward to seeing you again soon. Bye now.
Bye-bye.